I'm going to start off with kind of, before we get into what's Part A, Part B, C, D, whatever, just give you the few heads up notices, things that you should be thinking up now before you enroll in Medicare. Your first opportunity to enroll in Medicare is always at age 65. You have a 7-month window to do that, 3 months prior to your birthday month and 3 months after. When you turn 65, you will be auto-enrolled. Otherwise, you need to enroll yourself. So if you're not, again, if you're not pulling Social Security benefits now, Social Security doesn't know about you, doesn't know your age. So you need to be proactive and go down and sign up for Part A, Part B. You really want to sign up 3 months prior to your birthday month. You sign up on your birthday month or after that, again, you won't be in a penalty situation. If you don't sign up for like B and D when you're first eligible, there are penalties. That said, even if you're not in a penalty situation, you enroll in that 7-month window, you're without insurance if you enroll the month after your birthday month, even the month of your birthday. So you really want to get down there 3 months prior to your birthday to sign up. And the last bullet over here, Part B, your doctors, your labs, your ambulance rides, and Part D premiums are based on this modified adjusted gross income. So if, as an individual, you're making more than 87, or as a couple more than 174, you will pay more, for instance, for your Part B premiums, typically $144. If you're above this income, you're going to be paying a bit more than that. Go on to mymedicare.gov and create an account for yourself in Medicare, just like you do for Social Security. It certainly helps. Now it says probably the more important thing to do is you can create and modify your prescription drugs that you're taking. But beside that, you can print out another Medicare card. You can, instead of waiting for your quarterly explanation of benefits from Medicare, you can go in there and find it out much sooner than waiting for your mailing. But again, creating this drug list is a biggie. It will, based on that drug list, you'll be able to pick a Part D drug plan. Without it, you need it. You need to pick out a drug plan based on your prescription drugs. Medicare Part A and Part B. Part A costs you $0 premium if you've worked and contributed for 10 years. Part B for 2020 is $144 in change for a premium. There is a deductible of $1,408 each time you're admitted to the hospital. For Part B covers 80% of the doctor's costs, your medical bills, again, your MRIs. So you pay the 20%, and there's also an annual deductible of $198. Again, the Medicare was never designed to cover all your healthcare costs, but we'll get into supplements that are available to you. So ways to supplement original Medicare. So what we went over, Part A, Part B, that's original Medicare. Part A is, again, hospitals. B is your doctors. We haven't talked about drug costs yet. Original Medicare doesn't cover drugs, prescription drugs. So, ways to supplement original Medicare. Medicare supplement insurance, also called Medigap, will fill those gaps in coverage. There are actually 3 plans, but only 2 if you turn 65 on or after January 1st of this year. Those two plans are Core and Supplement 1A. Again, Supplement 1, it's for folks that have already been in Medicare, so they're kind of grandfathered in, if you will. What's very nice, very nice about the Medigap supplement is you have the freedom to go to any doctor, any hospital that accepts Medicare. They accept Medicare, they accept you. Don't have to worry about a network of doctors as you would if you had an HMO or a PPO. Go to anybody you want. The cons, if the Medicare doesn't cover the service, the supplement plan will not cover the service. And there's yes and no to that, and I'll explain. But for instance, Medicare doesn't cover some routine care such as dental or vision. Therefore, Medigap plans do not cover dental and vision. And they do not, we haven't talked about prescription drug costs yet, so the supplement doesn't cover drug costs. You have to buy a separate drug policy. And why I say it's kind of sort of true and not true, you can get riders for the supplement. So for example, Blue Cross for $2 and change has a vision and hearing rider. So you pay an extra $2 and change a month, and you get an annual eye exam and $150 toward glasses or contacts, whatever. So that's the supplement. I want to contrast that to the Medicare Advantage plan. That's what it's also known as Part C. And this is kind of what we're familiar with in the workplace. Typically folks have HMOs, PPOs, and this is very similar to that. You go to the doctor, you have a copay. There are some deductibles. The copays don't exist. Okay, so the HMOs and PPOs. The HMOs, again, you have to worry about the network of doctors. Premiums for an HMO with or without a Part D prescription coverage can vary depending on the county and coverage options. Again, we're in Worcester County. What I'll be showing you is specific to Worcester. Pros to an HMO. You're encouraged to get the annual physical that's not covered by Medicare. Medicare has something they call a wellness check. They have a annual wellness check that differs a bit from a physical. First time you join Medicare, you have I believe a 12-month period to give you a welcome to Medicare physical. But after that, they're all wellness visits. Con, and this is a big con, you have to stay within the network, and typically referrals for services. If you go out of network, the HMO simply not pay. I had a gal come by, her primary was covered under her HMO. She went to him, he referred her to a specialist. She goes to the specialist, walked out with a $1,000 bill because the specialist did not accept, was out of network for that. If you're thinking about the HMOs, again, I don't want to discourage them. They're very cost effective for a healthy beneficiary. But you always have to ask, is this procedure, is this doctor or hospital covered by, a PPO gives you a little more flexibility. So a PPO, and again, the same with or without Part D, really, again, to avoid, I highly encourage you to pick up an HMO or PPO that has drug coverage. Well, let's see, PPOs. They're much like the HMOs. The only difference is you can go out of network. You may pay a little bit more, copay, but you can go out of the network. The a caveat there is, though, still you have to ask, is this, even though they're outside the network, do they accept your PPO insurance? For example, not this year, but last year in 1999, St. Vincent, all the Reliant doctors in St. Vincent's would only accept Tufts plans. If you had a Blue Cross PPO that you were outside the network, terrific, it's okay from Blue Cross perspective. But from the Reliant doctor's perspective, I don't want to deal with Blue Cross, I'm only dealing with Tufts. Again, that changed in 2020. Now, the Reliant doctors accept Tufts, Fallon, and a number of others. But again, it's I can't stress it enough. You have to ensure that your doctor's covered. Prescription drug plans. I don't like the order of this. Because kind of prescription drug plans belong more with the original Medicare. But let's see. Medicare Part D plans are private insurance plans that help with prescription costs and protection, blah, blah, blah. The standard plan requires to pay a monthly premium. There's an annual deductible, sometimes waived, and co-pays. If you have a prescription drug plan, even if it's an HMO PPO, and you just have, unfortunately, a lot of prescription drug costs, and you end up in what they call the donut hole. So there's various stages. You can go along through kind of the initial Part D plan, and I think 4,000 and something, is that right, Ed? You get into the donut hole. Now, once you're in the donut hole, your costs change, not for the good. But if you're in the donut hole, Massachusetts has a benefit program called Prescription Advantage, and it will help pay those prescription drug costs when you're in the donut hole. Again, it's a Massachusetts state benefit. Fall below this certain income level, you'll be eligible for what they call extra help with your prescription drug costs. And then if you're a VA, VA has what they call the credible Part D drug benefit. So if you're eligible for that, you don't have to take a drug plan here. Because again, the VA plan is called, the key word is credible drug coverage. We know there are gaps in Medicare. Doesn't cover everything. So you have two ways to fill those gaps. You can go down this path, original Medicare, or the alternative would be the Part C, the HMOs or PPOs. No matter what path you go down, you need Part A and Part B. Okay? If you try to pick up a Medicare Advantage plan, they're not going to talk to you unless you have Part B. So you're going down original Medicare. You need to pick up a drug plan. The cheapest ones, and they're good ones, the cheapest ones are around $13. The benchmark is, I want to say, around $35. And then decide if you need to purchase that Medigap supplement. And it's, again, it ranges from $104 to, it doesn't make sense to pay this $271, but that's what the range is. Okay, so this again, this goes over the gaps. Why do we need supplement insurance? And this kind of explains what Medicare pays and what you pay without supplement. Okay, so let's get to the drilling down to details a little bit more. So now we're talking about the Medigap plans. So this is where you go through original Medicare. So you need a Medigap plan and a drug plan. So again, these are the gaps that we're worried about. The costs, our costs with original Medicare. Again, Part A is your hospitals. If we're admitted, $1,400 deductible. And then you can go through, I don't want to go through all this again. But for most of us here, we have two choices to fill those gaps. Medigap Core or Medigap 1A. Again, if you turn 65 before January 1st of this year, Medigap 1 is also an option to you. So what's the difference between all these plans? If you're in this core plan, you're still on the hook for that deductible. If you're in the Medigap 1A, that deductible goes away. So you're in the hospital, they release you to a rehab center. You're in a skilled nursing facility. First 20 days, no cost to you. After that, $176 a day if you're in the core program. That cost goes away if you're in the Medigap Supplement 1A. So that's another difference. So that's one difference. There's another one. And if we get down to Part B, there's really no difference between core and 1A. This annual deductible still exists. Goes away under this one. So you can say we're looking at the Medigap 1A. You could go to Blue Cross and buy that policy for $178 a month. Or you can go to Humana and buy that same policy for $282 a month. Well, why would you, right? So that's why Blue Cross is a very popular program. It gives you very good coverage at the lowest premium. There's one in here. Now, the one thing, and it's a slide that I've gone by, I didn't point out, but it's a very important benefit in Massachusetts. It's for the Medigap plans, there's something called continuous open enrollment. So at any time in the year, you can call up Blue Cross and say, all right, I've got the core plan now, beginning of next month, please put me in the Medigap 1A plan. And vice versa. Later on in the year, you can say, I'm in the 1A, please put me back into the core. Now, why might you do that? Again, if I'm getting my left hip done, it's not an emergency thing, I can plan that. I want to plan that hip replacement for next month. Call up Blue Cross this month, and say, hey, look, starting next month, please put me into this plan. What happens? That $1,400 deductible goes away. And when I'm done with my hip replacement, I'm done with a rehab, I can call them up and say, please put me back into this lower cost one. Many people, and I have folks come back and years later and say, is this still true? Is this still valid? And yes, it is. So it's continuous open enrollment.
Is that just for Blue Cross?
No, that's for all of these carriers.
What about prescription drug with this?
That's the gotcha. Yeah,
You have to do prescription drug plus. It doesn't cover prescription.
that's
drug.
correct.
So you go back to that.
And the prescription
Wow.
drug is the one where we have to worry about, we can't, there's no continuous open enrollment with a prescription drug plan. You need, you pick one during open enrollment, October 15th through December 7th, or you need the special exception. Again, worth mentioning now, you're gonna leave here and at some point you're gonna decide what plan you want. If for whatever reason, you're in that plan and that plan's not working for you anymore, it's costing you too much, there are a boatload of exceptions that can get you into a different plan outside of open enrollment. For instance, when you're first joining Medicare, you have a 12-month period for a do-over. again, when I went with the $0 PPO, I ran with that like 5 months or so, and I said, well, you know, I'm really risk adverse. I don't wanna have to worry about getting caught with my doctor being out of network, whatever. I'm gonna change, go to the Medicare. So I did that, and because I'm in that 12-month window, it's not a problem with Medicare, because I'm continuous open enrollment. I can always make a change now for the first of next month. It's the drug plan that needs the exception. And that 12-month initial enrollment in Medicare gives you a do-over. There are other do-overs, there are other exceptions. Might not be the most optimal plan, but Blue Cross happens to be the only 5-star rated drug plan. So you can, at any time in the year, switch to a 5-star plan. That's why we all kind of strive for the 5-star rating, so that, you know, you and me and whatever, we all rate this guy at 5-star. That's, Blue Cross loves it, so people can jump to that using that 5-star exception for a drug plan. But again, there are, I don't know, what we have here, like a couple of dozen drug plans. Again, these are not continuous open enrollment, so you need to make your changes during open enrollment, or come to a Shine Council and we can figure out an exception to get you to something else. But you've got the carrier, the plan name, preferred pharmacies. Now every plan has their network of preferred pharmacies. I'm looking at this Blue Cross one. They take CVS, Costco, Hannaford's, Osco, Stop and Shop. This is why when you get into mymedicare.gov, they're going to ask you what's your favorite pharmacy. So they'll take that into consideration when they're picking a drug plan for you.
Can you do more than one pharmacy?
Yes, you can choose 2. I happen to run with this Envision. So I lied to you. I said I paid $13, I'm paying $14. But it gives me a number of options. Okay, so when we get to these other columns, there's a deductible. Part D, there's an annual deductible of $435 before the drug plan starts picking up costs. But the star, if you look at the footnote, the star tells me if your prescription drug is a tier 1 or a tier 2 drug, they waive that deductible. So, many of the blood pressure medicines, the statins, they're all tier 1, tier 2. So they'll waive that deductible, and again, I'm looking at just this first one. If it's a tier 1 drug, I'm gonna go to this pharmacy and pay $2 for a copayment. How you read this is your tiered drugs, tier 1, 2, 3, 4, and 5. Go back. Now, a word of caution, I mean, we do this for folks all the time, do those searches. If you decide to do it yourself, just understand that when, today, again, this whole web-based drug plan search is new this year. By default, they come back with listing the drug plans by the lowest premium. So your $13 premium would always be bouncing to the top of the list, regardless of your list of prescription drugs. What you want to do is change that sort sequence to say total costs. Please consider my premium and my drug costs, and it'll reorder that list for you. So that's the real prescription drug cost, the real plan that you want to take a look at. Here are the Medicare Advantage plans, the Part C plans. MA stands for Medicare Advantage, not Massachusetts. Okay? Now, in this area, the popular plans Blue Cross and Family. Simply because, why? We have to worry about our network of doctors. For instance, Hayward Hospital does not have a Medicare contract with Tufts. You go there with a Tufts insurance, that bill's on you. There's a caveat, now, you can go anywhere, if there's an emergency, whether it's in or out of the network, if you're rushed to the hospital for emergency, you don't have to worry about that in or out of network. All plans, in all hospitals, doctors have to accept emergency costs. I mean, they don't look at the network of coverage. Blue Cross and Fallon are the popular ones because of Hayward Hospital. Some people make the trip to Worcester and you know, the St. V's or UMass, and they will take more. They will take, for instance, Tufts is another popular plan, but these are the two most popular, Blue Cross and Fallon. They have 2 networks, but 3 plans. Their 3 plans are the orange, green, and blue. Their 2 networks are Plus versus the Plus Central. And the difference is Central, HMOs, you always have to worry about the network of doctors, right? The Central even limits you more than that. They're pretty much like Reliant doctors. Pick up a plan and study it hard, the Fallon plan. On the flip side, you pick up, if you're okay to go Reliant, St. V's, and you kind of like that plan for $0. They also give you like a $500 bank card that you can spend on medical stuff. That's the green. The orange will give you a $1,000 bank card to cover, again, you have to see exactly what they cover, but might be like dental work and whatever. But yeah, Fallon's another popular plan because those bank cards. Sign up when you're first eligible, hopefully within the first 3 months before you turn 65. Once you have your Part A and Part B, you have 2 choices to make. Either go to original Medicare that requires a drug plan and a supplement, or Part C, which are HMO and PPO. We have Blue Cross, we just looked at the Blue Cross and the Fallon and all those, even the $0 plans. Again, very, very popular plans. For the supplements, you have to pick out a drug plan. I happen to have $14 drug plan. In the supplement, I go with the core. Again, if I have any planned procedures, hospital admittances, I will call them up and say, put me into the 1A, which will cover my costs. Let's see, I'm here outside of open enrollment once a month, the second Friday of the month. I'm in Westminster on the second Wednesday of every month. But yeah, that's kind of a wrap.